my head's killing me. It feels so stuffy.
Sinusitis. Most people experience its discomfort at least once in their lives, and some people have recurrent bouts with it for years.
No, I cannot get rid of this. Antihistamines don't help. Antibiotics aren't helping. Nothing helps.
In either case, there are many ways to treat its effects and bring you relief.
It's been over a month since I was here with that bad cold, but I can't seem to shake the runny nose and stuffed up feeling. And I always seem to be tired.
Yeah, it's been a while. When you blow your nose, is the discharge clear or is it discolored?
It's kind of a yellowish color.
Any postnasal drip?
You mean into my throat?
Mm-hmm.
Yeah, it seems like I'm always swallowing it.
How about any pressure? Do you feel any pressure up here or down in this area here?
Yeah, especially here, above the eyes.
And you said you're always tired or fatigued. Well, these are typical symptoms of sinusitis. It's very likely that your sinuses are inflamed, and there could be some infection present.
Sinusitis is most likely to occur right after the flu or a cold. This is called acute sinusitis. To understand how it develops, let's examine how healthy sinuses look and work. Sinuses are air-filled cavities inside the head. There are 4 pairs of sinuses located on either side of the head. They are the frontal, ethmoid, sphenoid, and maxillary sinuses. These air-filled cavities lighten the head and affect the way your voice sounds. Normally, the nose and sinuses produce between 1 pint and 1 quart of mucus a day to wash away any irritating particles that have entered the nose when you breathe. The mucus and the particles are automatically swallowed down the back of the throat. Stomach acids destroy any harmful bacteria or other harmful substances. Some things are more irritating to the nose and sinus cavities than others, like air pollution, tobacco smoke, allergies, and even common colds. These irritants can cause swelling in many areas of the sinuses. If the swelling affects one of the areas critical for drainage, eventually the drainage openings can be blocked and the sinuses fill with fluid. Bacteria starts to grow in the fluid. The sinus or sinuses can be infected and produce discolored, foul-smelling mucus. The blockage causes pain in the areas of sinus congestion and may even cause fever. This is acute sinusitis. For the vast majority of people with acute sinusitis, medical treatment can clear up the problem and minimize the chances of recurrence. Medical treatment may include decongestant pills or decongestant sprays for short-term use, antibiotic medication, giving up smoking, using steroid or other special sprays, or following a regular program of allergy shots. If these measures do not prevent the return of acute sinusitis, more antibiotics may be prescribed. If the sinusitis is very severe or doesn't respond to medical treatment, the maxillary sinuses may be cleared out with a procedure called irrigation. This may be done in the doctor's office or an outpatient clinic. Using a swab, a local anesthetic is applied inside the nose. Then a tube is inserted into the sinus. Irrigation may open up the blocked sinus passages and help to obtain a bacterial culture sample. There is mild temporary bleeding and some discomfort.
Doctor, I've still got this constant drip and stuffiness. I've even lost my sense of smell.
You've had antibiotics prescribed 4 or 5 times this year, Ms. Palmer, and the infection just keeps on coming back. I think you're getting sinus obstruction over and over again. What we should do is to take a closer look at where the sinuses drain.
In many cases, the doctor will do some additional examinations. One type of examination is rhinoscopy, where the doctor looks into the nose. Sometimes a microscope is used to magnify areas. Another procedure that is done in the office using a local anesthetic spray is called endoscopy. The endoscope is a small telescope that is designed to be inserted into the nose to see the sinus passages. It may help the doctor identify causes of sinus complaints that cannot otherwise be seen.
I can see some abnormalities which may be causing your sinusitis.
Aside from allergies, the actual internal shape of the nose could be the cause of blocked sinuses or sinusitis. For example, two important internal structures in the nose that can cause blockage are the septum and the middle turbinates. If the septum is misshapen or deviated, or a turbinate is enlarged, this can narrow and block the sinus openings. Another cause of blockage is the growth of nasal polyps, localized areas of swelling of the nasal tissues which can obstruct the sinus openings or even the nose. Blocked sinuses don't allow mucus to clear. It builds up, and the result is a continual low-grade infection. With medical treatment, the sinuses may drain. But if the membrane surrounding the openings remain inflamed, the sinusitis will keep coming back. This is a condition called chronic sinusitis. After many bouts of sinusitis, the mucous membrane and underlying bone of one or more of the sinuses may be damaged from repeated infection. To help with the diagnosis of chronic sinusitis, sometimes a test procedure called a CAT scan is done. This computerized X-ray is best conducted when the patient is clear of the symptoms of sinusitis or a cold. The CAT scan can show what the sinus passages look like, which ones are chronically inflamed or have narrowed openings, and the extent of sinus disease.
Ms. Palmer, we could continue medical therapy for your sinusitis, but the results of my examination, your history, and the CT scan all lead me to suggest that surgery might be a better option. I think that we should do surgery to open up the blocked sinuses and to remove